Hopefully you caught part one of this talk on body contouring after significant weight loss. The first part dealt with the types of procedures, motivations, and some decision making and showed a lot of photos. This part is really going to talk about ideal candidates, some of the risks, recovery, and costs associated with this type of surgery. So let's get right into it. So who's right for body contouring after massive weight loss? Well, these are guidelines. We like to spend a lot of time understanding a patient to know that they're the ideal patient, but here's a guideline. BMI is a rough guide. That's really just a ratio of your height and weight. And we do have a rough number of 32 where we feel like patients are ready for surgery. But much more important than the actual number is the position that we started from and where we're trying to get to and where the patient lands in there and whether they're ready for the consultation and ready for the surgery. So it's a number we look at. We don't put too much emphasis on it. Timing after weight loss is very important. So we really want to have weight loss stable, and we want to have a period of time of stability as well, so that we know that when we're doing these big procedures, we're going to have results that last a very, very long time. And so usually we want about 3 months of stability. If the patient had bariatric surgery or lost weight with some of the GLP-1 agonist medications, then we want, 6 to 12 months after that procedure or those medications were started to really have stability. Doesn't mean we can't start the conversation early, but it does mean we want to wait to do the surgery. Medical issues are very important. These are big surgeries. We want our patients to heal really well and get back to their normal lives. And so we need very tight sugar control in diabetics. We do not operate on patients that are actively smoking. And we want to control other medical problems like blood pressure, any liver issues, bleeding issues, things like that we will go through in a lot of detail. And finally, motivation, which usually isn't a problem in patients that have lost a lot of weight. Our weight loss patients are extremely motivated, but we need motivation because these are big surgeries. They have a significant recovery associated with them, which we'll talk about in a minute. And there are some scars that we need to be able to accept that we're going to have these scars in exchange for the contour and the comfort and confidence that we're going to have. And so that's very important from a motivational perspective. There are patients that are not quite there yet, but they're on their way to being the ideal candidate, and we're happy to see those patients too. Those are often patients that are moving along their weight loss goal, but they want to start planning. They want to start planning financially. They want to start planning time off work, things like that. So very important to get those messages out early and to get that education early. And so we're happy to see patients on their way during their weight loss goal. Uncontrolled medical comorbidities, so medical problems that are not quite yet controlled, but they're under active treatment, and we're working towards it. So we'll see patients with that. Smokers that are motivated to quit. Okay. BMI, I put it there again just to say that it's not a cutoff. We will gladly see patients with higher BMI, but we will talk about how relevant that is in that specific patient. And then, of course, as we'll talk about, these are expensive procedures for the most part, and there are significant financial barriers, and we very much like to get in front of that early and try to help patients through that barrier, and we can spend a lot of time with that. So those are patients on their way to being the ideal candidate. So which procedure should I have? We talked about it as we went through the different procedures. Patients come in, they want to have their arms done first. That's a priority. They want to have their face done first or their tummy. And the truth is that there are a lot of areas that we've gone through, and each of these areas is often affected in some way. But the good news is that it really is up to you. We have designed this specialty to be able to look after these procedures in almost any order and to make almost any combination you can imagine. This is very new, but it is something that's a great advantage to patients that have lost a lot of weight. And so in the end of the day, we're going to spend a lot of time talking about what your priority is for procedures and for areas you want to start with, and also how you want to combine them. And that's really the next question. Which procedures can we combine? Well, believe it or not, this is the short list. Okay, these are just the most common combination procedures, but I can tell you every week or month that goes by, we put another combination together because a patient has different needs, different goals, different motivations, and we design the surgery specifically for them. That's what you can do when this is really a focus. So, what are the risks? And we talk about this with every surgery, minor surgery, major surgery is very important. We'll spend a lot of time, particularly at your preoperative appointment, talking about all this. But it's also very important to put this in context. And so, again, I'm going to reiterate that these are life-changing procedures that will bring tremendous benefit to both the shape and look of your body, and also to the function and psychology and to the way that you feel. And so we have to weigh the risks against those. And when you do it that way, the risks are very, very important to discuss and very, very important to avoid, but they become much less important in the grand scheme of things, and the result really becomes the focus. Having said that, there are the general risks of any surgery. Those are things like bleeding, infection, blood clots, anesthesia problems, scarring that's maybe not as ideal as we want. And so we talk about all of those different things, but more importantly, we do absolutely everything we can in preparation for surgery and then after surgery to avoid all of those things. They happen in the 1% to 2% range, and we are very good at looking after it when it happens. The more specific risks to this type of surgery, body contouring after weight loss, are wound healing. I always tell patients the more centimeters of scar that you're going to place on a person, the more likely that a little area opens up or is slower to heal, needs extra bandages, needs extra treatment. That's quite common. And again, we're very good at looking after that. And so we'll coach you and guide you through that and get you through it, no problem. There are lots of numb areas as we remove skin. The more skin we remove, the more nerves we remove. And so a lot of these areas will stay numb for a long time, sometimes forever. And we talk a lot about that. Many repeat procedures. And so this means that there are other areas that patients identify as a problem after they've looked after the primary area. And that's quite common, right? We commonly hear patients say that have, large droopy breasts, and we lift the breast and reshape and fill, and they're super comfortable. And then they look down and now they can really see their tummy. And so now the tummy is a problem. So it was always there, but it is something to think about in advance, that there are likely to be a few areas that you're going to want to look after. And depending on the weight loss, how we lost the weight, how fast, and really what the skin looks like, the skin has lost a lot of its elasticity. And so when we really lift and fill and tighten everything after surgery, we do see a little bit of relaxation of that skin. And sometimes we'll go back 6 months, a year, 2 years later, and retighten a few areas to really restore that contour. So that's really, really important. Some patients recover a little slower than we expect. We're going to talk about recovery in just a minute. But that is something we talk about. And again, we are pretty good at assessing how the recovery is going to be. And if you need any extra help, extra coaching, more information, we'll give that. And then the last is symmetry. Most of the body has two sides, or in the example of breasts, two breasts. And so we work very hard to restore symmetry. And once in a while, when things aren't exactly the same, we'll do a small revision or something to really have the best symmetry possible. So those are a lot of things we talk about specific to body contouring. Okay, and the last thing here really is recovery after body contouring. The best way to look at this is like a journey. Okay, you've been through a weight loss journey, or you're working through a weight loss journey. Well, the surgical journey is another part of this journey. We start on day 0 with surgery, and we want patients out of bed on day 0 or on day 1. There is no lying in bed or staying in bed after these types of surgery. We expect that patients do a little bit more movement over the first few days, and by 7 days, patients are walking very well with very little pain medicine. Okay, by week 4, patients have returned to basically normal activity, but without anything heavy or strenuous. So there's no sports or exercise or anything that really strains. That starts at about 6 weeks, where we call that the point of return to full activity, including starting exercise. And really at that point, patients are essentially back to their normal lives, but they've still got some swelling, and the contour isn't exactly how it's going to be long term, etc. That we really see at about the 3 month mark, and that's when patients go out and buy new clothing and bathing suits and bras and things like that. And then it takes about a year to even 2 years until the scars really fade. And that's when patients are truly and completely comfortable and happy in their new body. So, as I put on the bottom here, nobody lies in bed continuously. Every day should be better and easier than the last day. And we will coach patients through every single stage. We see patients a lot, either in person or virtually, throughout this entire journey. So we make sure that we stay on track. The last issue here with this type of surgery is the costs. I've mentioned it a couple of times. We are very transparent and upfront about the costs. They are significant. You can see here just the single procedure costs, right, for each of these. And you can imagine that most of our patients are combining a few of these. And so the numbers really do add up. Of course, when we combine procedures, there is economies of scale, and the combined price is never equal. It's less than the individual prices, but these are significant financial commitments, and we want you to be aware of them. We will work with you a lot to make them appropriate and reasonable, and also to help with financing options, payment plans, and things like that. Our coordinators are excellent about that, and we'll talk about that really upfront so that everyone's on the same page. So I invite you to get in touch with us any which way you can or want, or with your physician. As we started here, knowledge is power. We do this. We start with a lot of education. We want patients to be really, really comfortable in their decision, to spend a lot of time thinking about it. The result of that is that we have really nothing but unbelievably happy patients that go on to beautiful lives of comfort and confidence, functionally improved. All of the things we talked about happen because we spend time teaching and talking about and understanding all of our patients. And so it starts with reaching out to us, telling us about your journey, and letting us figure out how we can help. I also point out the website at the bottom there, weightlossbody.ca, has a lot of the information that I've presented in this talk, lots of before and after photos, and a great resource for patients who are thinking about body contouring after massive weight loss. I hope this helps and look forward to helping you in this journey.